Mr. President, a few minutes ago, my colleague from Missouri, Senator Blunt, took to the floor and spoke to two issues that we have in common. I'll speak to one of them in a moment, the flooding in the Midwest, but I'd like to also address another one which he raised on the floor. Senator Blunt has been in an extraordinary position, given an opportunity to handle the appropriation bill for Health and Human Services. Within the Health and Human Services appropriation bill is funding for most of the biomedical research by the federal government. I've spoken to Senator Blunt over the past year and even before about my strong feelings on this subject. I feel, as most Americans do, that our investment in biomedical research is a wise investment, sparing people from the disease and death that could follow from an illness, but also making an investment in America's innovative economy, creating opportunities for jobs and for expanded research and new products and pharmaceuticals. Senator Blunt took that challenge to heart, and when he was faced with the appropriation bill for this department, made a special effort when it came to medical research. I am so happy that he did. It was only a few years ago that we had automatic across-the-board cuts called sequestration. It's devastating. As a net result of that, many of the youngest and most promising researchers gave up on the field because they didn't think that there was a commitment from Congress, from the President, from the government to continue and expand biomedical research. We saw the median age of researchers climbing because younger researchers look for other jobs. That is a horrible waste of talent and a squandering of an opportunity, I'm sure, to find ways to make life more bearable and to cure diseases across America. Several years ago when I visited the NIH, the head of it, head of the National Institutes of Health, Dr. Francis Collins, told me that if we could have 5% real growth in biomedical research at the NIH for 10 years, he could light up the scoreboard. We were on the cusp of so many discoveries that this was an opportunity, if the investment were made, to really have some medical breakthroughs. I took that to heart, introduced a bill called the American Cures Act, and I'm sure Senator Blunt and many of my colleagues are tired of hearing about it. But the notion is a 10-year commitment by Congress, 5% real growth each year when it comes to the NIH. As it turns out, this year we are knocking on the door of doing just that with the investment that was made by the appropriation bill. This investment is almost $42 billion in biomedical research, $32 billion at the National Institutes of Health. That's a 6.6% increase over last year. $7 billion for the Centers for Disease Control and Prevention, a 4.5% increase over the fiscal year 2015. There are two other areas of research opportunities in biomedical research: the Veterans Medical and Prosthetics Research Program and the Department of Defense Health Program. That's an appropriation bill that I have something to do with, working with the chairman, Senator Cochran. Both those programs received a 7% increase over the previous fiscal year. These increases in NIH, CDC, Veterans, and Defense are a real turnaround. They bring to an end decades-long downward trends when it comes to biomedical research. But Senator Blunt has said, and I have too, this shouldn't be a one-hit wonder. We've got to repeat that this year when it comes to the appropriations for the next fiscal year beginning October 1st. We've got to make sure that we make our promise and keep it when it comes to biomedical research. If we do it, this level of funding, I know, is going to result in dramatic positive developments. There's so many areas that we need help with. I think of a few that are obvious. Alzheimer's. An American is diagnosed with the Alzheimer's disease once every 67 seconds. When my staff told me that, I didn't believe it. Said, go back, recalculate, tell me the real number. Turns out they were right. Once every 67 seconds, a person is diagnosed with Alzheimer's. Last year, we spent over $200 billion in Medicare and Medicaid for Alzheimer's care. That is just a fraction of the total cost. Think about what individual families spent, what private insurance sources spent, the charitable care that was given to Alzheimer's patients. but $200 billion. So when we talk about increasing the NIH budget by $2 billion for 1 year, it's a tiny fraction, it's 1% of the amount that we're spending on Alzheimer's. If we could find a way to detect Alzheimer's earlier, delay its onset, reduce the period of time of suffering, or perhaps even a cure, God willing, it would have a dramatic positive impact on so many lives and families and on our bottom line federal budget. Now take that argument about Alzheimer's and apply it as well to cancer. How many of our families and friends are suffering and fighting cancer right now? My wife and I were struck over the holidays by how many of our close friends are battling cancer at this moment. We know that they're looking for hope, they're looking for drugs, they're looking for something that'll break through and give them a chance at life. That's why I believe this biomedical research is so critical. Let me add one postscript. Stopping with these agencies is not enough. I recently visited the Department of Energy. The new secretary there, Ernest Moniz, and I were talking about biomedical research. And he said, when it comes to the technology for imaging that is making such a difference in the world, it isn't just in biomedicine, it's in engineering and science as well, in the Department of Science, within the Department of Energy. So let's not be short-sighted. Let's have an open mind about innovation and creation. Last week I was in Peoria, Illinois, proud to represent it. Went to visit OSF Hospital there. Went to what is known as the Jump Center. You don't forget that name very easily. Jump Center. What they've done in the Jump Center is to combine the University of Illinois Medical School and the University of Illinois engineering departments in a common effort to bring new engineering and new technology to medicine and medical breakthroughs. What they're doing there is amazing. First, training doctors and medical professionals to do their job effectively without mistakes. And that, of course, is the ultimate outcome we're looking for. They do that. And over the shoulders are engineers and technicians who are looking at these doctors doing their work, finding new applications of computers and engineering technology that can make their work easier and more effective. They showed me the model of a human heart. It was a heart of an infant with serious heart problems. And this model that they gave me was the actual human heart reproduced of an infant who was facing surgery. They took the MRIs and the CAT scans, put them into a 3D copier, and produced this little heart that you could hold in your hand. They were able to give that heart to the surgeon to look at before the surgery. And they opened it so that that surgeon could look inside that heart model, a model which tracked the reality of that infant, and know before the surgery what he would find. It meant less time on the heart-lung machine, a more likely positive recovery. It was the use of technology and engineering to move us forward and to give that little baby a fighting chance. So I thank Senator Blunt. I want to especially thank my colleague, Senator Patty Murray. She has been a terrific leader in this field, both on the appropriations and authorizing committees, and also Senator Lamar Alexander. I think we've all come to conclude that regardless of how much time we have in the Senate, we should leave a mark that makes a difference. And when it comes to biomedical research, this year's budget, which Senator Blunt referred to, will make a difference. Now let's make sure it's not a one-hit wonder. Let's make sure we do it again in the next year's budget as well.